So I'm going to call up each panelist, read their bio quickly, and then they will take a seat. We'll start with Diane Urquhart. Diane is an experienced executive director and community developer with 40 years experience working for equity, effective community support, and community economic development. She's also the former executive director of the Social Planning Council of Ottawa, and she currently volunteers as a board member. Diane? Madame Stéphanie Plante, une leader communautaire très connue de nombreux d'entre vous. Elle est conseillère de Rideau-Vanier, du quartier de Rideau-Vanier. Elle siège au conseil municipal d'Ottawa. She was first elected in the 2022 municipal election, and as city councillor, she engages constantly with community members as she represents and advocates for them. Bienvenue, Madame Plante. N'importe où? Vous mettez n'importe où. Tammy Corner is an experienced community developer and facilitator working with Community Development Framework. Tammy brings a very unique perspective to this panel. Through her work with Community Development Framework, Tammy and her team are establishing collaborative work in the priority neighborhoods on priority issues. Welcome, Tammy. Next, we have Rebecca Aird. She's the Foundation's Director of Strategic and Community Initiatives. She manages the Foundation's Community Grants Program and the New Leaf Community Challenge. Is this the Community Foundation? The Ottawa Community Foundation, that's what I thought. And she also plays a convening and partnership development role when opportunities arise to build local cross-sectoral engagement and action on key issues such as youth employment, food security, affordable market housing, and carbon emissions reduction. Welcome. Next, we have Henry Akanko, who works with Hire Immigrants Ottawa since 2007, sorry. I was reducing the number of years. So he's been working with Hire Immigrants Ottawa since 2007, and he focuses on actually the initiative itself. Brings together employers and immigrant service agencies and other stakeholders to develop and champion solutions to systemic barriers around the integration of skilled immigrants into the Ottawa labor force. Welcome. And last but not least, because I'm going to sit here, Nuruddin Mohamud. Nuruddin is a project officer with he's got fans in the house. He is, oh, okay, so that doesn't count. Yeah. So he works in mental health and community outreach and focuses on the African, Caribbean, and Black ACB community. And he has an intimate understanding of his communities because he comes from that community. And he has seen firsthand the stigma that can surround mental health due to cultural biases. And during the COVID-19 pandemic, Nuruddin was a key advocate and worked at the front line supporting community members. So you can give them all a hand before we get into this discussion. And you can share mics this way and share mics that way, and I'll keep mine. All right, we're gonna get right into it. All right. So, Nuruddin, because we're talking, yeah, I'm gonna pick on you first. Because the lady who gave us that lovely speech talked about COVID-19 and its impact. As frontline workers, how did the pandemic impact the Ottawa neighborhood or communities that you serve, and how are you working to build resilient communities post-COVID-19?
Good evening, everyone. It's a pleasure to be here. It's a lot of familiar faces. We've been seeing each other through screens. I worked with a lot of people here, so it's great to be here in person. A lot of people, first time I'm seeing them in live, so in person, so it's great. I'm representing Ottawa Public Health. So the opinions that some of them will be from me as a person, and sometimes the good work that I will explain is what Ottawa Public Health has done. So there will be two ways that I will answer the question. One will be, what has Ottawa Public Health, what have we done as Ottawa Public Health? As you all know, Ottawa Public Health is a large organization when it came to working with a lot of different partners. When COVID hit, it was a pandemic that, nobody was ready for it. The magnitude of it, nobody was ready for it. So the best thing to do was we had to work closely with all our partners at the grassroots level. So working with partners that already worked in the communities, the neighborhoods, partners that had worked with the small businesses, community health centers. We had to work with agencies that did counseling, all the stuff, the school boards. We had to work with them and come up with a solution how we could, help the community. One of the major things, there's a lot of things that I could, touch base on. One of the things that
You have 5 minutes.
Yeah. One of the things I'm very proud of mentioning, and I'll just take that one, is the neighborhood wellness hubs that we have today and how it all started. As my sister mentioned earlier, the Black community suffered the most. And unfortunately, most of the Black community lived in subsidized homes. We lived in unfortunate situations where it was low income that suffered the most. They didn't have services and they didn't know where to go for help. The services were too far. Sometimes, they have to take few buses or taxis to get to where they wanted to go. So the service that was needed was not near the locations they lived. So we had to bring these services closer to the communities that needed them. So what we have done was open up a place where they could get their vaccination near their house. Like the Boys and Girls Club next door to them, like the community health center next door to them, a drop-in where they could come in and talk to a nurse, talk to someone, a counselor. We could make a short-term, counseling session for them, have a social worker there for them to talk to. So it was very convenient for them to come to these neighborhood wellness hubs and get their vaccine and have more onto it. The next question will be the one that I will add more, so I'll just take that 5 minutes. Should I pass on? Or still me?
Actually,
The same question.
did
goes
he
to
just
everybody?
turn my mic off? Sorry, you don't do that to a radio host. Cut their mic. No, I'd like you to finish your thought. You did sort of start mentioning the impact, kinda, but you went straight to an initiative to sort of because a lot of people were saying, getting vaccinated, that's too far, I'm not gonna do that, etc. Yeah. So problem solved by OPH. But the impact that you saw in the work that you do with ACB communities.
So the impact that I saw was OPH, not myself, I shouldn't take the credit, but there's a lot of us that are from the Black community that work at Ottawa Public Health. And we're proud to say that we now have within mental health, addiction, and substance use health department, we have our own, within that department, ACB branch within it, which means that we have a way to focus and see the needs of it. That came into ending because of the researches and everything that was done and the high stigma within the community. We learned, in order for me to go and have my community get vaccinated, they needed to see someone that looked like them, that had the same background, the same culture, the same kind of religion that they all follow. We had to start something. Where can we do that? And who could go to these people? It had to be someone who spoke their language. If it was from the Haitian community, someone from Haiti had to go. If it was from the Somali community, it had to be a Somali person. If it was from the Jamaican community or Congolese community, so we had people within Ottawa Public Health and partners, Tammy is here who could add on to that we had to make sure that, we met the needs in the community. So me being someone who worked closely with, grassroots organizations, we knew the stigma that we was facing our community that was holding back. And when it came to mental health, if I walked into a family of a mother of 5 or 6, she didn't have time to talk about vaccination. She wouldn't talk about her housing situation. You know what I mean? She has bed bugs at home. There's other bigger issues for the black communities. It wasn't vaccination. So what we learned was, when we knocked these doors and talked to people, they needed more than just vaccination. So the hubs that we had over there, we turned them. We had to upgrade them to a level where they could come to these hubs for more of the needs. When it came to employment, that father who was doing the frontline work now, like my sister was saying earlier, he can't work anymore. There's no income coming into the family. Who's gonna feed the mother with the 5 kids and the father with a single father with 3 kids? How are they gonna feed their families? The social income that they were receiving, we had to bring it closer. Someone for them to talk to about employment, housing, everything. Even if it came to dental screening, we brought it closer, right? So these wellness hubs that we have right now is not just vaccination. We decided to meet the need of the community and how we could help.
So basically, this COVID-19 pandemic, in a way, was a blessing in disguise for the ACB community, in that it forced Ottawa Public Health to listen and respond accordingly and adapt to the community that they were serving. That's what I'm hearing from you. So since he mentioned you, Tammy, we're going straight to you.
Can I elaborate to that before you go on? Just one second.
I just want to give her airtime.
I know it's a blessing, but also everything that happens in life, there's a reason, right? So that's something that we have to be very humble of. Something happened, not because OPH never wanted to do or never wanted to listen. It's about getting educated or moving forward in life, right? So we learned something, and we're very happy about it. And that's, what I vision it as.
Okay, thanks for that. Tammy, so tell us what you saw in terms of the impact, and also the programs, the CDF programs, and how they helped.
Okay, thank you. I want to say Jumbo, Salam Alaikum, Suba Akyur, Suba Wanaksen, Bonjour, tout le monde. It's really nice to be here tonight and see many familiar faces and new faces as well. And I look forward to getting to know you and the G7, to build a connection with and work with the G7. And thank you, Sarah, for that inspirational, passionate. I wrote down lots of notes. You were saying I was listening, I was ears, and my heart is responsive. So yes, we worked very closely with public health. So when COVID happened, we were really grateful for the CDF's many years of partnership with the community. I'll give people a little background about what the CDF is. So Community Development Framework is an initiative that brings together residents, community organizations, and city services in systemically disadvantaged priority neighborhoods across the city of Ottawa. We work in a place-based approach, and we address issues locally, the priorities the community identifies, and the solutions that they want to create. We work with them as partners on those solutions, and then we identify what systems changes are also needed and elevate that to those system partners, institutions and systems, to make that change. So the CDF came out of the Coalition of Community Health and Resource Centers. We're housed within the coalition. The coalition and the CDF partners, including community houses, Ottawa Community Housing, Ottawa Public Health, the City of Ottawa, Ottawa Crime Prevention Ottawa, Ottawa Police, Just Food, Ottawa Community Foundation, and United Way. And I just want to highlight that the Coalition of Community Health and Resource Centers and the Coalition of Community Houses came from the community. So I see the grassroots groups and what you're doing, and I see the spark of creating something similar, that those organizations are place-based, community-based, they came from the grassroots, they are places where they're governed by community boards. So anyway, I just feel like, go for it. So excited. So back to your question, sorry, I'm rambling. Just to say, during COVID, we had had many years of relationship building with the community. We had trust, and partners were working very well together, so we were able to quickly respond when COVID hit. We were able to say to public health, hey, let's work together, right? So we were able to plan and coordinate, collaborate together, along with all our other partners, and we engaged community in that from the get-go. We contracted resident leaders, 22 resident leaders who spoke 11 different languages, and and these were leaders who were already leaders in their community, and they were ready to go. So they're like, they wanted to do this work, and they were from the neighborhoods that were most impacted by COVID. So they were Black, racialized, newcomer leaders. And with public health data, we identified the neighborhoods, we recruited the leaders. They worked with community developers from those neighborhoods and public health to plan and do outreach. Getting information into the neighborhoods, as Noureddine said, was key. These people, the leaders, knew who to reach. They reached out to their neighbors that were most isolated to talk to them about how they were doing, what information they needed to get information to keep them safe, get them the support, to support building a relationship with public health or other institutions they might not have trusted, and to support getting information about vaccines, to overcome vaccine hesitancy, which was a lot of work because it was a process. So the resident leaders would talk with people, and then they'd go back and they'd talk again, and being present where the people are at and respecting where they're at, not pushing it on them. People had to make that choice themselves, but making sure they had an informed choice. I'm sitting with my back to you, sorry about that. That just so that people could be making informed choices, what's best for them and their families, and honoring the choices that they made. So that was really impactful. And I would say not only we had those 22 leaders, but in 2022, we went from, in 2015, we had 224 engaged resident leaders. In 2022, we had increased that to 441, I believe was the number. In 2021, 2015, we had just over 10,000 contacts with people, and in 2022, we had 172,000 contacts. And I just want to say that's because community stepped up. Like you were saying, community's like, we got this. We're going to do this. In community, the solutions lie with the community. And as partners, we are there to say, what do you need? What resources do you need? What can we do? And they trust us to work with them to support what they know needs to happen. And I see my colleagues and everybody out here, yeah, right? And it was really impactful. And it continues today. I say that momentum, because of this opportunity COVID provided, we have very engaged community members that are also now saying, we want to be working on other priority issues and opportunity, like community safety well-being plan that the city is putting together now. They want to be involved in influencing that, addressing issues like you were saying, Sarah, food security, mental health, housing, affordable housing, access to space. They're engaged in wanting to inform those systems and the changes that they want to see. I want to say another opportunity that happened just before COVID, we were also very lucky that the city introduced the Integrated Neighborhood Services team, the colleagues over here, Wendy and Emmanuel, and Fremp was here somewhere as well. So we have had more partners in the community since just before COVID and COVID, working, doing this work, supporting the community, and this culture of collaboration. And now as we move forward, we're like, how do we keep that momentum going? And I'm excited then about this G7 group as another opportunity for us to say, how do we collaborate and build community together?
Thank you. Thank you very much for that, Tammy. And I like that whole culture of collaboration. I know there are a lot of organizations here that have been working in that space of culture of collaboration for many, many years, and I like the whole system-based approach and really focusing on building the trust to get to the relationship, right? Because that's been a complaint for the many years I've been in the community, that they just show up and it's like they don't bother about relationship building or trust building or none of that. and they tell us this is what's happening, etc. And I'm so glad to see that.
Can I add one more thing?
Yeah, that
too, I
approach
think
has
is really
changed.
important. Is during this time, well, I just want to acknowledge that we've worked many years closely with Social Planning Council too, and that Diane is that leader really pushing us to be remembering and being connecting to the grassroots and ethnocultural grassroots groups that we've been connected with too. And I just want to acknowledge, Diane, your leadership over the many years, and you're missed.
We're going to come back
I
to
learned so much from Diane. So, and I think, anyway, I want to also acknowledge during COVID, importantly, because Indigenous, Black, and racialized newcomer people were most impacted, we recognized the importance of grassroots groups, and we built and are building relationships with that Ottawa Black Mental Health Coalition. We have an ACB youth
She's somewhere.
groups that we've been pulling together.
Yeah.
I want to say the Canadian Women of Color Leadership Network,
Yeah.
among others. So I just want to acknowledge that.
Yeah, thanks for that, Tammy. We're going to come back to Diane, but politics. Stephanie, you decided to launch into a political career in the middle of a pandemic. Why? Why?
Why not? Premièrement, je voulais juste dire allô à tout le monde. Je sais qu'il y a des francophones ici ce soir, alors
Oui, en
salut,
effet.
what's up? Yeah, so that's a very good question. I had volunteered a lot in my community. I had been president of the Parents' Council at my son's school, where we have about a 30% absenteeism rate every single day because we have a lot of OCH communities in there and a lot of families that are really struggling. So I saw sort of firsthand during the pandemic how the pandemic affected families and how there was a lot of disinformation and trying to help them and, just organizing fun events like, the kids would be at the park and we would sort of separate them all, but they would sort of figure out their own sort of socially distant games, and kids kind of figure things out really quickly, as you will learn. And then I was involved in a project, which Councillor King, also knows about. In 2020, I sort of looked around my neighborhood, and I noticed that not just in my neighborhood, but in all of the city of Ottawa, we had no city amenity that had been named after an Indigenous person. So we have things named after Walter Baker, and we have, what's the one up here? My name is blanking at St. Laurent Center. Jim Durrell, etc. And there was a woman in my neighborhood named Annie Putaguk, and she was a very famous Inuit artist, and she had passed away not too far from a park right near me that didn't have a name. And so I literally Googled, how do you name something City of Ottawa? And I was really naive and thought, I can do this. It's no big deal. And it is actually a very big deal to do some commemorative naming in the city, as I slowly learned. But through some really amazing partnerships from that commemorative renaming, the Premier of Nunavut stepped in to write a letter. Doug Ford wrote a letter supporting the project. Yes, I know.
Excuse me while I look surprised.
Cindy Blackstock got involved, one of my personal heroes. Everybody really came together once they saw the importance of this project and the reconciliation around it. And, in my neighborhood as well, I have the highest percentage of Inuit residents outside of Nunavut. So it's really important that people see their names on the toponymy of the city. And, my predecessor eventually announced that he wasn't going to run again. And I, had said, who's going to replace you? And then he wrote back, you. I went, me? And then, anyway, we went for coffee, and he sort of, I said, are you serious? Are you worried? And he said, I think you'd be great. I think you'd be really good. Now, he could have said this to many other people, by the way. I don't know. But he did say it to me, and eventually I knocked on almost every single door. There was a couple buildings for security reasons I couldn't get in.
How do you do socially distanced door knocking?
You can't. There were
How does
some
that work?
buildings. Yeah, there were some buildings I could not access for a variety of reasons. There were seniors in them that we were not allowed to get into. But if there was a door and I knocked on it and I could get in, I went in. And it was just really interesting because a lot of the stuff I had lived or my family had lived, it seemed like everybody was living, and everybody wanted to tell you about their experience and what they were living and their priorities. And and then an election night came, and the rest is history. But I really do love this job. I know that sounds really cheesy. I also j'aime beaucoup représenter la communauté francophone aussi, parce que c'est très important dans une ville bilingue qu'on reconnaît la communauté francophone.
C'est même it's not just that. The fastest growing black community is French speaking. C'est les francophones noirs in the black community. Just so y'all know, you need to learn some French.
Yeah, yo. Yeah, and I want to give a quick sort of shout out because I'm from the Windsor area. I grew up in the Windsor area, and there's my next commemorative mating project. I have this in my head. Do you know Marianne Shad?
Oh, please. As someone in the media, she is my
I know.
hero.
Yes, so that's
Provincial Freeman.
Yes, thank you.
First
and
black woman newspaper publisher
correct.
in North America,
Yep.
not just Canada.
So she's kind of my next person I really want to dedicate a public space to because, you know, recognizing the importance of the media and her contribution to that. She's not from the Ottawa area. I just want to make that very clear. But neither is Terry Fox, and we have a lot of things named after him. So, but yeah. So thank you for knowing who she is.
Well, I'm with Black History Ottawa. You would hope I would know this, and you might want to. Speaking of collaborative spaces, you may want to contact the Ontario Black History Society, and one of her descendants, who is the former president of the Ontario Black History Society.
Let's talk.
Yes.
Let's talk.
I'll put you in touch.
Rawson,
We'll
will you
work on it.
support us? I'm putting you on the spot. Okay. Yeah.
All right. So a lot of people who are doing campaigns were using digital means to do it, right? They were going online, etc. But a lot of things had to go online during the pandemic, including school had to go online, and people trying to get forms and all of that. But that brought up another problem in our ethno-cultural communities, and that's the digital divide. So I'm going to look at Diane, because you're an expert in the area of digital equity. Talk to us about that.
Yeah, so you've been through this, so I'm not telling you anything you know. Obviously, before COVID, we were seeing the impact of technology on every aspect of life. Education was moving that way. The labor market was completely transformed, where so many jobs were being lost to technology. And the technology requirements for people to get a job were accelerating. All of this was changing. Access to healthcare, this was changing. So that was all happening, but what happened when COVID hit was, of course, it highlighted what was going on, and it put into really stark clarity who had been having access to technology as a tool and who hadn't. Because before, it was kind of you could choose. You could connect with a doctor in person, or you could through technology. But when COVID hit, you couldn't. And this was true, obviously, with the schools and so on. So it wasn't that it was a new issue. Two things happened. It highlighted who was being left behind. And it also moved all of those services and all of those processes and the way the labor market worked way faster down the direction of technology. So now, even though we're back in person, the train has moved on. Now, that's the way healthcare is delivered primarily. Right. It's fundamental in education. It's a deal breaker in the labor market, and many, many jobs are remote. Now, the thing with technology is it's a tool. It's a means to an end. It's not its own thing. So of course what happens is you see that certain communities have less access to the tool. Right. And again, what COVID highlighted was that some people got even more access to the tools, and those who had not been able to participate through technology before got even less access than they had before. So maybe they could have gone to a public space to get Wi-Fi that they couldn't afford, but now they couldn't even do that. So COVID completely widened the digital gap and moved forward those, gave more opportunities to those who were able to be connected in with technology, allowed them to move forward and have so many more opportunities than other people. So it just worsened the inequity we already had. Now, people had been working on the issue of digital equity long before we got into this and before COVID hit. There were key players in the city working on that, and we always want to acknowledge that work. ACORN, an grassroots anti-poverty organization in the city, was lead on the advocacy for the inequity that this was creating and how low-income individuals and communities were being left behind. And they continue to be the lead on the advocacy, pushing for the major policy changes that have to happen at the federal, provincial, and local level to have these kinds of change, to have the changes that are necessary for equity. And National Capital Freenet is Ottawa's community-based digital provider, and rather than the big telecoms that are business-oriented, they're grassroots groups. They are a business, but they're community-based, they're community-run, they're community-owned, and they were lead on the connectivity, people having the ability to connect in. So those two were really lead on digital equity. What happened during COVID is it was impacting so many of the people we were all working with in the grassroots, in the community services, that some services stepped up and started providing some kind of additional supports. The schools obviously distributed devices and so on. The city expanded its hotspots, you know, that people could access and so on. And community agencies also were stepping up to some degree. So National Capital Freenet and the Social Planning Council proposed to many organizations in the city that we come together with an initiative to really scale up those collaborative initiatives. And that was called Digital Equity Ottawa. The City of Ottawa came in, Ottawa Public Health, the Public Library, the school boards, Community Foundation, United Way, several of the funders, and so the Coalition of Community Health and Resource Centres, many of those stakeholders. And the purpose of Digital Equity Ottawa and what it did was we put on the table, these are the issues that the community are telling us, these are the barriers. What can we do with the resources we have between us to leverage increased access? And it resulted in a new policy at the city with respect to their devices when the devices that city staff are using are no longer useful for them, or they can't use them anymore for their purposes, that they donate them through Digital Equity Ottawa, they're transformed, and they're given back to the community for free. It led to National Capital Freenet being able to work with the city, with Bell, and with some funders and some research to develop some initiatives to try and get more free access to free Wi-Fi in low-income communities. So that's moving forward. And Public Library expanded the programs it was providing and so on. Across the work that Digital Equity Ottawa and the partners were doing, which included some grassroots organizations, there were 4 strategies. Access to devices, access to connectivity, so the ability to have internet, ability to use, and there were many new digital equity, education, learning how to use technology or use it in more effective ways, most of which through Digital Equity Ottawa are led by grassroots groups. For example, the Grassroots ETHO-CULTURAL Seniors groups developed a very innovative peer-led digital literacy, digital training program, and other partners within Digital Equity Ottawa did as well. And the 4th pillar was the ability of community services to provide digital services. So Digital Equity Ottawa is still continuing, and the fundamental challenge, even though we're sort of in a quasi-post-COVID period, this inequity which we have seen still exists, and we have such a long way to go to resolve it. And so there is much work still to be done and many opportunities for people to participate. I want to situate this, though, back and emphasize that with that work, that technology is a tool, and in fact, the tool is necessary for people in their individual lives to get ahead, but also for community leaders and grassroots organizations to be able to make the kind of change they want. So this is a huge issue, this barrier. Some see it as the new equity issue because it's really worsening the gap between those who have opportunities and those who don't, like profoundly worsening the gap, right from the point of kindergarten up to the experience as seniors for those who are left, who are on the wrong side of the digital divide. So it's sort of a new key equity issue. But resolving that issue will only come from grassroots work and the leadership of grassroots groups, which has always been the case, and advocacy, and pushing for policy change, and also access to the tools for the leadership, for those who are leading change in the community, those leaders having adequate access to technology in order to connect and work is critical. So the path, it both comes from, the future comes from the groups having the resources and then working with their community members to resolve the issues and to push for systemic change.
Yeah.
Without that, I also want to say that we're talking here about COVID and situating all of this in the impact of COVID, but COVID was one of several profound changes or several profound cultural moments that happened in that same period. And I think perhaps while we can see the changes, COVID identifies or brought to light some of the changes on inequity in general. At the same time, what we came to understand from the Black Lives Movement, Black Lives Matter movement, and from the leadership of Indigenous communities when the unmarked graves were found, and they were able to clarify the demands that Indigenous communities had and clarify what the real toll of colonialism had been on communities, clarify that for others who had not understood that before. Those are really the drivers of change. So digital equity is the tool, and having access to digital means is the tool, but the fundamental issues we have to be looking at are the pre-existing inequities that we had, which were related to racism, colonialism, and poverty, which created the conditions in the first place that were exacerbated. So leadership, we have to support that leadership. The advance of digital equity has to support change on those issues, and those who are leading change and active in those change and impacted by those conditions are the ones that have to be prioritized in the digital equity campaign. We don't want to make this a new fix everyone so that they can use a computer. It's fix society so that people are not left behind, and we have not allowed the lack of access to technology to make even worse those oppressions that we had before.
Yes,
and those
and we're going to,
inequities.
thank you very much for that really fulsome sort of, yes, digital inequity. And I'd like to salute organizations like Jacques Combit, I see Joanne Robinson over there, Flow Seniors, and other organizations who focused on senior, like people who are isolated and people who, the shut-ins, the isolated people, et cetera, and how they managed to find a way to get technology to those groups to help them break the isolation, and the people who used the technology to educate our wider Black communities about vaccination, about OPH initiatives that a lot of people had no clue about because they don't necessarily live in the neighborhoods that you visited. Thank you very much for that. So speaking of needs, let's get to Rebecca and your involvement with the stakeholders. In your mind, what is the most critical need that you're seeing from stakeholders?
Ooh, holy smokes.
And you might be repeating some of the ones that...
Okay, but can I tell a joke first, just because, you know, there was...
It's very serious,
There
yes.
was a bit of it, I know, but there was, it connects to IT stuff that Diane was talking about. So, a priest, an imam, and a rabbit go into a bar. And the rabbit goes up to the bar, and the bartender says, "What would you like to drink?" And the rabbit says, "I don't know, I'm only here because of autocorrect." Meh.
Between autocorrect and you're on mute from all those Zoom meetings. And you're on mute. Yes, you are on mute. You have to turn the mic on. No, you don't. Yes, here.
Okay, sorry about that. Okay, so I just first want to reflect, as I'm hearing other amazing colleagues and activists and actors talk about all of the work that has gone on during COVID. It's interesting to reflect on how many touch points the Ottawa Community Foundation has had with those initiatives. And one of the questions that I was asked, and I obviously have to go completely off script here because whatever I was, whatever I had in my head that I might be talking about.
That's fine.
Does not necessarily seem like the thing to be talking about now. The question about where collaboration was at pre-pandemic where it was at during the pandemic and where it's at now is a really interesting question to reflect on. It's not that there wasn't a fair bit of collaboration happening before the pandemic, and I think Social Planning Council, Community Development Framework, the CHRC Coalition, the Coalition of Community Houses, there's an enormous amount of collaboration that was already going on in the community. But what happened during COVID is it just ramped way up around certain specific issues, around food security, around digital equity, around mental health, around connectivity. So anyway, the Community Foundation was able to get quite a bit of money out the door very quickly to support some of those initiatives, and some new things got started, including, for example, Food for Thought, which has delivered now close to 1 million meals to homes across the city, in OCH buildings, in hotels where immigrant families are unfortunately housed, and local families as well. And to, you know, clients of day programs and so on. So, you know, just one example, we were able to, and we were also able to fund many of the initiatives that Diane and Tammy have talked about. But through that all, and especially around issues like mental health and food and digital equity, there was such an amazing ability to push through what would have been barriers in normal times and to make things happen. We saw that, you know, so profoundly during COVID, and we're seeing that impact sort of recede, I think, right now. And we're also seeing, although there is still a strong will to collaborate, I think we're also seeing some sort of retrenchment back to organizations focusing on their own individual, you know, the health of their own organizations and their mandates. So, you know, it's an interesting time right now where we've witnessed a lot of energy and a lot of capability to break through red tape to get things done. We've witnessed a lot of collaboration, and now the question to us all, I guess, is how do we maintain, like what can we do to maintain that momentum?
So Rebecca.
Yes, I'm not answering your question.
No, but I'm picking up on this. So since governments and institutions have seen that when they mobilize quickly
Yeah,
and aggressively together
yeah,
to improve a situation, they actually get things done.
yeah.
Why would you want to go backwards? What is the upside of going backwards
Yeah.
and lessening that collaboration and going back to business as usual?
Yeah, well, I don't know. I mean, I don't think I have an easy answer to that. You know, systems reset to baseline fairly quickly, I think, is
And
a
what
sh- a
can
short answer
stakeholders
to
do?
that.
What can stakeholders do to sort of keep the fire under the bums
That's-
of these institutions?
That's a great question. I think, you know, the collaborative initiatives, the will to collaboration that this community of, you know, ethnically diverse people has demonstrated, I think is going to carry a lot of energy, and it already has. I mean, you know, Tammy mentioned the Black Mental Health Coalition. You know, there were a lot of initiatives that emerged, although I'm terrible on names. The initiative for you know, black women, Canadian, remind me, colleagues. You know, although that existed before the pandemic, I think the work that it is doing now in peer counseling, the degree to which it's mobilizing other actors, you know, that's really demonstrating the potential to continue the momentum and the pressure on the system that will allow that momentum to continue. I did want to flag a couple of ideas that that I think might be valuable or important. One of them is, during the pandemic, one of the things that we saw was a sort of a reevaluation of community safety that was done by the Community Health and Resource Center Coalition. That ended up being quite powerful because it effectively was one of the key pieces that got resources rededicated. Instead of a 2.7% increase in the police budget, there was a 2% increase in the police budget. 0.7% was reallocated to community needs, and that ends up being a chunk of change, like it was over $3 million. And that is now supporting some really interesting initiatives in the community. So what happened there was a collective effort to really distill some key messages about the benefits of upstream interventions versus downstream treatment. We don't, there's lots of evidence for the value of creating healthy communities, of, giving kids good access to sports, of, supporting cultural and language initiatives within particular communities. I mean, all the things that community development is about. There is lots of evidence for the benefits of that and the degree to which that can reduce societal costs from dealing with broken people if you don't create those conditions. But I don't think we collectively take enough advantage of the research that has been done. I think collectively we can distill messages down to a very few things. Politicians and decision makers don't have a lot of time for complexity. And if they hear the same message, even if you're giving examples from your own community, if the basic message is, if we invest in better access to sports and sports facilities for kids, these are the proven benefits of doing that. We can engage the academic community to help us to dig that information out. But we have to come down to a few key messages that everybody is willing to carry and keep hammering, because we're working against a system that is always more comfortable, and I'm speaking both public sector investment and charitable giving. There's a greater pull towards bricks and mortar solutions and towards high credential, expensive solutions to problems that arise, as opposed to investing upstream. So if we really want to be intentional about this, I think we have to get our messaging really solid amongst ourselves and be sure that we carry that messaging forward through a whole bunch of different channels. So that's one thing. The one other thing that I also wanted to just put on the table is we do talk a lot about needs. There is no getting around the needs that exist. The mental wellness crisis that exists right now is really largely a reflection of a lot of other broken things in the system, obviously, which really undermine the ability of community to work well for people. But there's been a lot of research and talk about asset-based community development, which means you really start by taking a look at what the good things, the capabilities, the facilities, the assets that you already have how those can be mobilized. And I think taking that one step further, talking about community wealth building rather than poverty reduction. I would like us all to actually take this message back to the city, because I love the fact that through the Community Safety and Wellbeing Plan, there's work going on right now on a poverty reduction strategy. I would personally, and I'm not speaking for the foundation here, but I would personally way rather see that framed as a community wealth building strategy.
And that's going to be Henry's piece. But just finish your thought.
Yes, exactly. No, that's perfect. This is the thing. There's energy aligning behind this idea, because the Community Foundation is very much into the community wealth building idea and into social enterprising amongst the organizations that we fund, which is part of community wealth building. And United Way has also embraced this terminology. And I think that there is, momentum now. It's an idea that's been around since the early 2000s. Again, there's lots of proof points for the benefits of it. We need to be investing in businesses, local businesses, owned by local people, creating local employment, and ensuring that that employment is equitable. And those are the foundations from which we can continue to build strong community. So there's a lot to the concept of community wealth building, but that's certainly part of it. And now I'll pass it on to Henry then.
You in a way you stole his thunder, and this No. Yeah, I know. I also am with the United Way, so I realize that. But the sister earlier who set the tone did talk about, the generational wealth and the lack of it. And you're with Higher Immigrants Ottawa. And just very quickly, can you tell us where Higher Immigrants Ottawa comes in to that, changing it from poverty reduction to wealth creation?
Thanks very much, and a pleasure to be part of this panel and this community event. I just, to clarify, High Immigrants Ottawa and United Way, so that we get that clear. High Immigrants Ottawa is a community-wide initiative of United Way East Ontario. So we are part of that organization, and I lead High Immigrants Ottawa, but I also co-lead our community wealth building work, which is one of the reasons why I was invited to speak to this. So that's where the connection is. So do you want to continue? Do you have a question before I?
No. The wealth and inequality issue. So how did you see that expressing itself in the work that you do with Higher Immigrants Ottawa?
Yeah, so
because employment was mentioned.
Yeah, employment is, and I'll speak more broadly than just employment within the context of the conversations we're having around COVID. Others have talked about extensively the impact of COVID on various facets of our lives, and employment was definitely not spared. Both direct employment for individuals. You recall early days when we pivoted to remote work, it wasn't everybody who had the option to be able to do that. There were some who had to go in to do work. A good number of them were members of the Black, Indigenous, racialized communities, mostly people doing low-end jobs and frontline work, exposing them. There were others who didn't have the technology to be able to do this. Small businesses, also self-employed, they employ people. They had to close with all the closures and openings. Foot traffic reduced, so they were not seeing that many customers. Everybody was shopping online, and some businesses have still not opened. And so before COVID, newcomers, members of Black, Indigenous, and racial communities had barriers entering the labor market, and that continues to be the case. What COVID did was shine that bright light on these disparities along several fronts as well. When we look at the question of inequalities, this is one that, again, has always existed and continues to exist. What we are looking at within the context of community wealth building is taking advantage of this crisis of a lifetime that we've experienced. And the questions we are asking is, if we reset and go back to business as usual, what lessons would we have learned from the pandemic? We saw all the collaborations that happened, agencies that competed among themselves, put that aside. Everybody was on the same page. We all had one common purpose, to get through this together. And so within the same spirit, as what type of approach do you use to be able to continue to galvanize the community and all of these stakeholders to move forward such that we come out of this pandemic in a way that is equitably closing the gap of inequality. It's fair, it's inclusive. So an inclusive economic recovery is very important. And as Rebecca pointed out, we need to look at the assets we have. This is not about starting new. You know, if anybody's worked with appreciative inquiry would recall, it's always about starting with what your assets, what your strengths are, what are your points of resilience, and then you build upon that. So what community wealth building is doing is taking the assets we have, the institutions we have, the resources we have, and refocusing this from the traditional business model that we have where we always think about profit and the bottom line in a very capitalist way. But thinking about this within the context of what is the social value marketplace, so that for the same things that we do with this lens, we do things differently and we address several issues and challenges that confront us. So if we take, for example, procurement, large organizations spend billions of dollars, especially governments, educational institutions, hospitals. All of us in this room, we spend money every day. And those spendings are decisions that we have to make, and they are choices that we have to make. So if we were to decide that we will adopt social procurement practices and patronize, for example, locally produced goods, buy local, buy from small businesses, we are putting money back in our economy.
Right.
We are creating jobs locally. The value chain in all those business processes is putting money, it's elevating people out of poverty. So we address a number of issues there rather than procuring everything from outside. Community benefits agreement is another example. We have big infrastructural projects that are developed and built. Often we get told or invited to come out and see the plans, and we have superficial consultations around them. But here we are talking about having an agreement and involving the community in the decision-making process to identify what are the other social values that could also accrue to them if things were done slightly differently. Other factors were incorporated in the design and execution of this infrastructure. So, for example, we could have agreements that speak about workforce development. So let's take the Ottawa Hospital, for example. This is a big infrastructure project. It's going to take several years to build. If we had a community benefits agreement as part of that contractual process, we could say, as part of this, we want to have a workforce development component. 20% of the workers who work on this project should come from our community. We want to target certain communities in Ottawa that are underrepresented in the labor market and provide skills training so that they can work on this project. So we talk about a shortage of skills trades. That is a place where we could have trained some youth in our communities to be able to work on this project, and that is a benefit to our community as part of this project. There are other things that could also be part of it. For example, talk about environment. Can we create communal parks within that area where the community could use? That could also be a place where patients at the hospital recuperating could also use. So there are several other dimensions that we can build into this when we think about using these community well-building principles. So these are things that we already have. These are things that we already do. It's about how do we empower our communities to be part of those governance decision-making processes as well. What are the systems that we put in place? Many of the social services sector also were hit by this, and so we saw government provide some funding to help build the resilience of the sector. There again, we continue to see the sector struggles to be able to serve people because of all the resets that is happening. What are ways that we can, as a community, work together to address some of these shortfalls and challenges so that we can better serve these communities that are underrepresented and adversely affected? So there are several pillars around this. I can go into detail with some examples as well.
Well, we kind of are running out of time. But what would be great would be if anybody is really interested to hear more about how Higher Immigrants Ottawa is working on, some of the ideas that you have after the panel discussion would be a good opportunity. And we really are way past our time.
Yeah.
So there's going to be but these discussions are like day-long discussions, right? We can't be up here for like the next 6 hours. We could be. So I'm going to give everybody, it's going to be a lightning conclusion round with 2 minutes.
Beautiful.
2 minutes, and you're going to use your 2 minutes for that. We will conclude by post-COVID, what do you want to see in your particular area that you're working in, the space that you're working in, the organizations you're working in? Post-COVID.
Do you want me to?
We'll start this way, Tammy.
Oh,
We're going to go round. You have 2 minutes.
2 minutes. Oh my gosh.
Yep.
Okay. I want to see us, as we were talking about, continuing to work together. I want to see us diversifying the partners that we're working with to be mindful of people who are being most impacted by not only COVID, but the current ongoing inequities, deepening inequities, rooted in food security, increasing poor mental well-being. And I think one of the things that's maybe a challenge for us right now, where the collaboration, as you were mentioning, Rebecca, I'm curious about that. It's not the same. I think it's because there are so many, we were focused around COVID, during COVID, all of us around one issue, and there are so many issues right now, affordable housing, food security, mental health crises, that we're all focusing on these many issues now that's pulling us in many different directions. So I think we need to figure that out, and how we can continue that collaboration, strengthen it, get us aligning around these issues. So I think that's something that, when I'm thinking about how do we do this in a decolonizing way, and what does that mean? What does that look like? So it's learning as we do this too, as we shift these structures and systems, and keeping the community at the center of it, being led by the community, being responsive to the community, which I think we've been good at, and I think we can keep doing that. And I feel really hopeful about the future because of what we did together during COVID, and all that we did build, the trust, the partnerships. I see there's opportunities that are emerging, as in the G7 Collective is an example of that. It makes me feel hopeful for the future. So I feel excited about the opportunities going forward.
Thanks, Tammy. Diane, in the digital equity space, what do you want to see in 2 minutes?
In 2 minutes.
In 2 minutes.
Well, there's one specific piece, and that is that the SPC is putting out a challenge. We'll be officially launching at the end of July, where we're encouraging you to put digital equity in the public space, bring it to the attention by doing some kind of activity. We have one group, for example, a group of young people who are going to do a bowling tournament to raise awareness about digital equity and raise some money for that and try to bring this forward. Ottawa is a tech town, and we're leaving a quarter of our population behind in terms of technology, and we don't have the kind of momentum in this town that others have. So let's turn that around. So we're looking to launch something mid-July, and we're challenging you today in this meeting to identify within your discussion groups, on top of your questions, how we can contact you in late July to get your idea about how you could mobilize in your network to do something kind of innovative between July and the beginning of September to really put a focus on this issue. This brings us to what I want to see. So what I want to see is I want us to tackle the digital equity, the digital divide in a meaningful way in this city, and I think it's entirely unacceptable in a tech town that we don't do that. However, there are many people working on it, so there's opportunity. What it brings us to is what we've heard right from Elder McKay, Tyson's father, and all the speakers that have come here. Change comes from the community. It comes from those who are most affected by the issues, defining what the most effective solutions are, pushing for them, and organizing among themselves and in allyship with others to move things forward. That's how we get policy change. That's how progressive politicians move forward things, by being able to tap into that. That's actually what the solution is. We haven't just reset to baseline, a pre-COVID baseline. We have reset to a baseline of greater inequity than we had before, and a train moving that's accelerating that. But what we also saw through COVID was the power that we can turn that around. Whether our lens is anti-racism, anti-colonialism, or digital equity, we can take that on by working together. So there's a very short-term thing. Identify in your discussion group, make sure, you're registered here, but yeah, contact me, SPC in July. We're going to have an idea in my network how we're going to advance digital equity. It doesn't have to become your main issue. You just add it on. How is the digital divide affecting the issues that you have been working on? And how would addressing the digital divide for your community members improve equity for your community? And what's kind of an innovative way you might raise awareness on that, raise resources? Fundamentally, the way forward is make change or make money for change and support the change makers. That's the way.
Thank you very much. Thank you, Diane. And in the municipal politics space at City Hall, what do you want to see post-COVID?
Housing, 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 housing,
Amen.
housing, housing,
Amen.
housing, housing. Yeah, and if I can just drill down for a bit, we absolutely need to wean ourselves off emergency shelters, whether those are hotel spaces. If you've been to the corner of King Edward and Murray, you're like, there is just no excuse. It's 2023. Everybody deserves a home. Everybody deserves a key. Everybody deserves dignity. Amen.
And all those empty condo towers all around those same places that you're talking about. Housing, yes. OPH, in the public health space, what do you want to see post-COVID?
Who wants to see housing?
Yeah, definitely. I'm just going to take my hat off as an OPH for a little bit and speak as Nuruddin, who works at Ottawa Public Health. The people that got hit the hardest when the pandemic happened were Black people. So for me, I want to see a big difference within the Black community. I want to see a unity within the Black community. We need to come together and figure out that, right now, for example, there's a lot of fundings going out there that's being given to all the Black organizations. Is going through other major organizations, not directly to a Black organization. We need to change that. The only way we're gonna have a better, outcome to come out of this is to have something serious for our community. We need to have our own facilities, right? There is no facility. Talking about housing, our community, 50–60% lives there, right? If you go to Penny and Ritchie, where that area is, it's all Black young kids playing basketball. What future do they have, right? So we need to start having facilities where when something like this happened, this pandemic that took us, we need a place where we could say, okay, I know where I'm gonna go for help, right? I have a center. We have newcomers from Africa, from the Caribbean. There is a Black shelter where they're gonna go, and we're gonna have the right languages there. This community is big enough. Like my sister was saying earlier, the Black community is the largest community right now that's a visible minority. How is it possible that we don't even have something together, that we're not together yet, right? So right now, sorry to put you on place, Tony.
You do have 2 minutes,
wellness
right?
hubs, yeah. I'm sorry, you allowed me to talk. I talk a lot.
And it's not Sunday.
The wellness, the ACB Wellness Center, I don't know, a lot of you know, she's doing a great job, Tony. How many people know about it that's in the Black community, that's supporting,
Road,
right?
yep.
We need to do that. We need to do a lot of this work for each other and come together so that when a pandemic like this happens, I know there's politicians here or anything, they have to come to us for votes, right? So they're gonna come to us, work with us, and being honest together, we need to show our support to them, show them how much we need them, be behind them so that they're strong enough to do the work that we do, that we need them to do. So I just want to see a better community within the ACB or the Black community overall.
Thank you very much for that. Yes.
Okay, well, definitely cannot argue with that. And this is an and, but there is a lot of fragmentation of organizations within the ecosystem of social services and social welfare right now. Actually, it's interesting that the ACB Wellness Center is joining in an exploration with ANYO and the Canadian Women of Color Leadership Network and Restore to try to figure out how they can consolidate and collaborate on services, but also on some of the, kind of back office stuff. Because anytime you set up an organization, you've got a lot to manage that does not get you any further down the line in terms of actually moving the issues that you're concerned about. So I think we really got to think in terms of backbone organizations. Social Planning Council is an amazing backbone organization that is now led by an incredibly capable Black man who will have his eye out undoubtedly to ensure that the aspirations that you have spoken to will be realized. Don't go out and create another organization. Work with the Social Planning Council to really make sure that there is that strength and cohesion to what you're doing. There's a lot of things that would be wonderful to see, but I will just, picking up on what Henry has been speaking about in terms of community wealth building, the Community Benefits Coalition, the Ottawa Community Benefits Coalition, has been working really hard to try to bring a policy direction into the City of Ottawa on community benefits agreements. This is not easy stuff. As was said earlier, you're used to not easy stuff. But we need to really rally behind the idea that the city adopts a strong community benefits agreement policy. And then we need to put all the infrastructure in place that is needed to realize the commitments that are made in community benefits agreements, because frankly, we don't have that infrastructure right now. We don't have the training programs for disenfranchised folks to learn building trades and to work on site, et cetera. So lots of work to be done there, but I think we got to start somewhere. Let's start with making sure the city adopts that policy.
And last but not least, Henry,
Yeah,
and we will stick to 2 minutes.
Could
because
just say a
yes.
detour to Rebecca on that, and to add to needing the city to adopt a community wealth building policy is also calling on the communities present here. That process involves community groups' involvement in deciding what are some of the needs, the benefits that come out of this. So we need to play an active role in engaging in some of those consultations to make sure that those social values and benefits that accrue to us are incorporated when we sign these agreements. The other piece as well is looking at how do we support small businesses. We have many people within these communities that have small businesses that continue to struggle. Like I said earlier, purchasing decisions at a small level are ones that we all have to make. We need to consciously support our local businesses. We need to also make sure that the bigger anchor institutions that have bigger purchasing powers are also spending a certain percentage of their funds supporting small businesses. One of the challenges that I would like to see is working together with the community to find ways to help small businesses build their capacity to be able to respond to big orders. Because it's one thing knocking on doors and asking bigger institutions to spend their dollars locally. It's another thing having the capacity to be able to respond to those orders when they do place them. So it's a two-way issue we are looking at, the demand side and the supply side. And we all need to work together to push these issues together. Thank you.
Well, thank you very much, Henry, Rebecca, Nuruddin, Stephanie, Diane, and Tammy for all of your thoughts and your reflections.